We just learned that this second patient, this healthcare worker, flew on a plane from Cleveland to Dallas the night before she was diagnosed, or she went to the hospital showing symptoms of Ebola. She traveled from Cleveland to Dallas on Frontier Airlines flight 1143.
Right now, we're being told that Frontier Airlines is reaching out to advise any passengers that would have been aboard that flight from Cleveland to Dallas on flight 1143 with Frontier Airlines. This is a concern because, of course, they want to make sure they have this contact research done of everybody that the patient would have come in contact with. One of the things, though, is if she hadn't been symptomatic, is there a risk? So obviously, we want to have that conversation with our medical professionals.
The CDC specifically says that she exhibited no symptoms on the flight, that the passenger crew says she exhibited no symptoms on the flight, and that that airplane was cleaned that night and then again the next day. Nevertheless, the news that she was on a plane and not restricted in her travel, interesting in and of itself. Should any healthcare workers who had come in contact with Thomas Eric Duncan, should they be flying at all?
Well, I think this is the question that so many of local residents are asking right now. We know that she did not have any symptoms when she was on the plane, and so that means that she was not at risk of transmitting the virus to anyone. But given now Frontier Airlines is asking more than 100 people to come forward and to contact them, that's going to increase the amount of work, the amount of resources we put into contact tracing, and it can really make people panic a lot more. So we may need to see some changes in protocols based on the idea that there is so much concern and anxiety around Ebola. Perhaps we do need to address the idea that if you are self-monitoring, you should stay within a certain area.